Hello and welcome. Today I'm going to kick off kind of like a 5-week video series, HardWired Movement Method. And this is something that I came up with through, again, my years of practice. And it's something that we can use to maximize our movement, our ability right now, something that we can use to build more movement potential, and something that we can use to reset and prepare the body to move and perform the best that we possibly can on for any reason, whether it's a workout, whether you got a sports game, whatever it is, you got a hike, whatever. It does not matter. It's something that we can all use and we should all be implementing to some capacity into our daily routines. So I'm going to break down the first two uses, or just kind of expand on the first two parts of the HardWired Movement Method: breathing, doing some breath work, and then some rolling to work on a few things and teach some vestibular led action, stuff like that. So if you attended my presentation at the SaskMilk Saskfit Conference that was put on by Saskatchewan Parks and Recreation Association, just want to say thanks again for coming. This is going to be a little bit more of an expansion on the first two steps there that we went through. If you didn't, that's okay. This is going to be something that is going to be useful for you as well. And let's get into it. So first thing we're going to, I should say, I'm going to take you through the way I do it for my movement prep. This is something that I do before I train, before I play hockey, golf, doesn't matter, anything physical. That I make sure I do this every day. And I basically have go through a bunch of different progressions of each, the rolling, and then the breathing is a little bit more abbreviated because I found the right amount, or what works best for me. So I'll take you through that, and this is how I do it. This is how some of my athletes do it, but then all my other clients, they have this same routine to some degree, right, scaled for them and where they're at in their journey. So from here, before I do anything, I do some nice deep diaphragmatic breathing here, really in and out of the nose, tongue's on the roof of the mouth. And for me, I can kind of reach the state that I want to be in about 5 deep ones or so. And so all I do is breathe in and out of the nose. And each breath I try to get a little bit deeper and a little more expansion to my rib cage. And there's the deepest breath I take, and my ribs starts to really start to realign. My rib cage starts to rotate properly. From there, once I kind of feel like I have maximal movement in my ribs, I've got that deep breath I can take, and I go into my end range exhalation. But for this one, I bring my knees up to increase the amount of the trunk, or I bring my feet up, I should say. Take a nice deep breath in again, try to fill the rib cage. And then on the exhales, I go through my pursed lips, engage my pelvic floor. Create that intra-abdominal pressure, rib cage is moving down. Relax, expand. Exhale. Make sure I'm recruiting from the pelvic floor, not from the scalenes in the top of the trunk. So there I've primed the body to create brace as well as realign the trunk. I'm feeling pretty good. So that's the way I do my breathing. It's going to be very individual depending on how quickly they can get the rib cage and get as relaxed as they need to be, how quickly they can scan their body, or what works best for them. For me, I find that amount of time really allows me to relax into it, but I do it a lot every day, right? So it's been taking a lot of practice, and I get to that state that I'm looking for a little bit quicker. Next thing I'm going to do is my egg roll here. This one, I always like to start with the egg roll for sure because it really is just vestibular system led. Your eyes and your head are leading the rotation, move of the body. And for this one, I'm looking for a feeling as well where I'm not really muscling anything over. I'm just letting the weight of my leg drag my other leg over. My eyes and head are really just directing traffic. My focus here is just looking as far past my shoulders as I can. And usually I do 2 or 3 of those. And again, you can do as many as you need to feel the desired feel, or like, again, you don't have to do 100 of them, but make sure it's really focused on letting the eyes and head lead. From there, I go out into into some lower body rolling. Now this lower body rolling, we're gonna go. I go arms fully extended. That's gonna get them out of the way. So then when I'm rolling over, they're not getting in my way and blocking me. If there is shoulder issues, like if you got an injury or something like that, you can also do a little bit of an abbreviated version with your elbows in here, where you bend the knee and reach it past the hip type of thing, and reach past the shoulder. But for me and for most clients who can get to this overhead, we're going to do the full lower body roll. I like this because it starts to kind of loosen things up through the hips, through the spine, and then it also gets that kind of proprioception, that joint, kind of joint awareness, and that pull from the big lever of the leg. So I start by bending my knee, my left knee will say, and then from here I extend my leg and reach my big toe as far away from my hip as I can on this first one, really trying to get this stretch to the outside of the glute. And then once I start to roll and my hips start to go, I just gently sweep my heels back just together, and I just kind of follow and just let my body follow the lead of the leg. To get back, we go through a little hip extension, bend the knee, engage the glute, lift the hip up, reach the leg over, and then from here, when the hips start to go, extend and roll. Then I do that the other direction. Now from here, after that, my second one, I usually do a little bit more of a spiral roll. So this is going to get that same rotational aspect, but we're going to get it a little bit quicker here. So I bend the knee, keep the knee bent, and I'm going to reach the knee past my hip. And as soon as both my hips start to move, I quickly extend the leg and I kind of spiral and whip over. So it's going to increase that rotation, but it's going to just the processing of it. Then from here, I bend, extend, and reach, straighten. And I do that both directions. So that's your lower body rolling. That's like kind of level 2. It's a real feel good roll. From here, I move to my upper body rolling, and on this one, we need to incorporate the eyes a little bit because our levers up top, our arms are not going to be able to have enough weight to drag us over. So we are going to look a little bit more at that eyelid here. Our eyes are involved. We're going to work on some thoracic rotation more than anything, but again, we're kind of getting that rotational sequence going down the spine and through the hips and everything. So I'm going to start with my left arm extended in front of over my chest. I'm going to start by looking past my right hip and then reach my left hand at the target that I pick. Keep looking past my left fingertips. Reach. Just let my body just kind of follow, sliding that flat palm to the floor. Then from here, you're going to look past the left shoulder, make a little chicken wing with your left elbow, reach the elbow up to the ceiling, and then extend the arm. The second one that I go is straight across the opposite armpit. So the arm's extended. Look past the armpit, reach. Should feel nice spread of the shoulder blades here. Everything's kind of loosening up. Again, flat palm down. And then to get back, eyes, elbow, extend. And the last one, I'll go past my opposite ear. So I look past my opposite ear and I reach and I keep reaching. Try not to push, don't muscle. Reach. Again, let that body segment and follow. Eyes, elbow, and back over. And then I do that on the other side. So from there, we're working that three-dimensional rotation. We're not just staying here doing open books. We're getting a lot of good different planes of rotation here, right across center, neutral. Life happens all over the place. Things between the shoulder blades start to loosen up. Again, we're getting that good sequence of rotation from the eyes all the way down to the legs, to the feet. Everything's kind of working together. The last one that I do, and this is kind of like one of the end points. Not as many clients get this one, but some do. This one is we'll call it a pretzel roll. This one's going to incorporate the brain a little bit more. It's a little bit of a tougher move. You got to have some nicer, things that be moving really well. Eyes are going to be important in this one. So we're going to start with in kind of like your bug position here. You're going to take all I'm going to do is take my right leg. I'm going to swivel it behind my left, grab my right ankle with my left arm. Then from here, I'm going to look past my right shoulder, reach my right hand up, and then I'm going to just uncork this and extend. So I'm going to extend my left leg. Yeah, I should be keep my right ankle held with my left arm, and then from here, look past my left shoulder, and then uncoil it. So you cross, you're getting that kind of contralateral action. Eyes, lead, everything unfolds. You get that nice stretch in through the quad. You get that nice stretch of the frontal chain, and then it does get that cognitive aspect, that coordination into it a little bit too. So that's going to be that's my rolling sequence that I go through. Again, this is, you scale it to whatever clients or whatever ability you have at this point, and then you can kind of work up through the steps on those. That's just the sequence that I feel best prepares my body. Everybody is individual, but we all need this we need this vestibular, we need this sequencing training in our routine. So join me next week if you like what you saw. If you have any other questions, put them in the comments or whatever. All right, see you later.